welcome to our Monday Minute. Today we're going to be doing a recap of 2024 for home health, as we have already ushered in 2025. To say that 2024 was a rocky road for home health is an understatement, as we had to maneuver many things, including continuing the fight against rate adjustments with CMS. We are hoping that with some very strong advocacy from across the nation, we will be able to improve that situation in 2025. As we began 2024, we were beginning to see the release of the new OASIS E1. That OASIS E1 was in draft form for several months, has been finalized, of course, and the guidance manual was released at the end of 2024 with very few changes and updates, and that new document went into effect January 1st. So any MO90 dates, the date the assessment was completed, that is January 2025 and later, will require the OASIS E1. The home health value-based purchasing expansion, of course, began in 2023, made itself very well known in 2024 as we began to see the results of the 2023 activity, which was the first year of the nationwide expansion. The results from 2023 are now in, and agencies will have somewhere between a 5% decrease and a 5% increase in payments for 2025 based on your annual payment report update from your total performance score calculations in the expansion. Make sure that you are accounting for those as you begin to look at revenue adjustments, etc. The interim reports are continuing to be released, of course, now showing activity from 2024. And when we get to July, we'll begin to see some results from 2025 where there have been multiple changes in the home health value-based purchasing model. With the final payment rule release, we did see changes for that value-based purchasing model that include the GG items being a significant focus. In addition, the final rule brought to us a behavioral adjustment that is a permanent adjustment to payments of a negative 1.975% as a result of the market basket increase. We did have a very small net increase in payment, but obviously we need to continue to fight because over the course of the last 3 to 4 years, we have lost significant percentages in our base rate for traditional Medicare. So please continue to participate in that advocacy. Also, starting July of 2025, you will be required to transmit OASIS complete and transmit OASIS for all patients, regardless of the payer, if those patients qualify for OASIS completion. Make sure that you review those guidelines. In the final rule, we also saw a new condition of participation, which includes the acceptance to service policy. That acceptance to service policy will need to be implemented in 2025. We are waiting for final guidance as far as its impact on surveys, but please make sure you are following those updates. The face-to-face encounter being done via telehealth, which began with the public health emergency back in 2020, was originally extended to December 31st of 2024, and with the signing of the American Relief Act of 2025, that has now been extended to March 31st of 2025. So we will continue to follow the face-to-face encounter via telehealth information. The BFCC-QIO had some changes earlier this year. One of them, KeyPro, which is a very large one for the nation, had a name changed to Essentra. Make sure that you have updated that information in your patient documents. Also, the Notice of Medicare Non-Coverage form was updated to go into effect January 1st of 2025. This form is to be used for all patients that require a Notice of Medicare Non-Coverage form, and for Medicare Advantage patients prior to 2025, you were giving them the Medicare Advantage plans information, you now have to give them the BFCC-QIO information. Do make sure you are using those new forms. As open enrollment just ended in December, many patients have made changes to their Medicare coverage. Please ensure that you are double checking the eligibility files to ensure that you are billing for the appropriate payer as you move forward into 2025. All of these changes seem vast, and they are. Some of them very significant changes. I failed to mention in the case mix weights and wage index changes, CBSA changes, covered in our recent billing update. You can get more information on those as well. Healthcare Provider Solutions is here to assist your home health agency in any way necessary to help you maneuver all these changes and continue to thrive as a successful home health agency. Most importantly, HPS would like to thank each and every one of you for continuing to care for patients, even in these trying times of payment cuts and regulatory changes. Have a fabulous week.